My name is Jessica Warren, and I'll be presenting a geriatric syndrome presentation over dementia. Geriatric syndromes are a clinical condition that occurs in older adults and does not fit into the category of disease or illness. It is multifactorial, associated with poor outcomes, substantial morbidity, impairment of multiple body systems that often include falls, dementia, delirium, dizziness, urinary incontinence, frailty, osteoporosis, sleep disturbances, and weight loss. What is dementia? Dementia can be defined by a cluster of symptoms associated with a decline in thinking or skills or memory affecting the person to complete daily activities. Dementia is the loss of cognitive function, thinking, remembering, and reasoning, along with behavioral abilities. Functions that can be affected by dementia include the ability to focus, to pay attention, self-management, problem-solving, visual perception, language skills, and memory. Dementia can range from mild, only affecting a person's functioning, to severe, leaving a person to completely depend on others. Significance. Individuals who suffer with dementia require specialized care, leaving the significance to the nursing profession at an all-time high. It is projected that by 2050 there will be 152 million cases globally, and minimizing exposures to risk factors which are associated with the onset of dementia could possibly prevent 50.7%. Nurses spend intensive periods with clients providing intimate care through the development of therapeutic relationships and are educated in delivery of evidence-based practice that produces optimal outcomes for patients. As the number of patients increase yearly that are diagnosed with dementia, so does the number of properly trained providers in order to provide high quality of care. Statistics. In the United States, 5 million people are living with age-related dementias. Currently, there are 47.5 million people living with dementia worldwide, and 7.7 million new cases are diagnosed yearly. As baby boomers continue to age, the number of newly diagnosed dementia is expected to rise, estimating 1 out of 6 women and 1 out of 10 men over the age of 55. The most common form of dementia is Alzheimer's, accounting for 60 to 80% of cases. Subjective data. Allergies. No known drug allergies with mild seasonal allergies. Current medications include lisinopril with hydrochlorothiazide 10 mg, 12.5 mg PO/q day. Cholecalciferol 50,000 units PO/q week. Gliprazide 10 mg ER PO/q day. And simvastatin 10 mg PO/q day. The patient's immunizations are all up to date and she is on track. Past medical history includes hypertension, vitamin D deficiency, diabetes mellitus type 2, and hyperlipidemia. Subjective data, presentation, common complaints, and ROS. Presentation. This is a 73-year-old female Caucasian who presents with difficulty recalling items from short-term memory, finding the correct words, and communicating with family and friends. This patient might also present with symptoms such as trouble handling money or bills, completing familiar tasks at home, poor judgment, lost in familiar places, misplacing things, or a change in mood or behavior. Common complaints. The patient reports being unable to recall short-term memory. The family confirms this and adds that the patient has been increasingly agitated due to the inability to recall and difficulty communicating. ROS. General, denies any fever, chills, night sweats. Respiratory, denies fever, shortness of breath, wheezing, or cough. Cardiovascular, denies palpitations or swelling. GI denies nausea, vomiting, diarrhea, or abdominal pain. GU reports mild incontinence at time, denies burning or nocturia. Neuro reports memory loss, difficulty communicating, slight weakness, denies headache, recent falls. Psych, family reports depression, agitation, anxiety, denies any suicidal, homicidal ideations or paranoias. Health maintenance and disease prevention. Health maintenance is essential to promote independence throughout all stages of dementia. Using evidence-based interventions when problems occur can help maximize the quality and quantity of life. Disease prevention. There are no preventative measures for genetically acquired dementia. Currently, trials are underway to find preventative measures for all other types of dementia. There is current strong evidence that individuals can in fact reduce the risk of dementia by making lifestyle changes. Recommended lifestyle changes include eating a heart-healthy diet, performing daily exercises, wearing seat belts, fall-proofing your home, and anything that you can do to prevent head traumas. Objective data. Vital signs. BP is 110/68, heart rate is 72, respirations are 16, temp is 98.2, and O2 is 98% on room air. Physical examination. General. The patient is alert and oriented to person, unable to recall time, place, or situation, appears well nourished. Respiratory. Symmetrical chest wall expansion, no deformities or lesions noted. Lung sounds are clear and equal bilaterally with no adventitious breath sounds noted. Cardiovascular. Irregular rate and rhythm. Present, no murmurs. Radial and pedial pulses are +2, equal and bilaterally. Eyes, perla is present, red reflex is present with no visual aids noted. GI. Positive bowel sounds in all 4 quads. Abdomen is soft, non-distended, non-tender with no apparent masses or lesions noted. GU. No CVA tenderness is noted with palpitations. Neuro. The MMSE score is 23. The Romberg is positive. Cranial nerves are intact. And reflexes are +1 in patella, ankle, biceps, and triceps. Psychological. The patient appears agitated and slightly anxious. Skin is dry, intact, clear with no signs of dehydration noted. Screenings and tools, diagnostics, and labs. Screening tools. The MMSE was performed and the patient scored at 23, indicating cognitive impairment. The Global Deterioration Scale for primary degenerative dementia, her score was a 4, indicating moderate cognitive decline or mild dementia. Her ADL score is a 4 out of 6, indicating a medium-high dependency to others. In the caregiver strain index, she had a score of 8, revealing a high level of stress for the patient's caregivers. Diagnostics, a CT of the brain to rule out a tumor, bleeding, or hydrocephalus should be obtained. A PET scan to access the brain activity and determine if the protein has deposits in the brain. Labs. The Mayo Clinic reports simple blood tests can detect physical problems that can affect the brain function, such as vitamin B12 deficiency or underactive thyroid glands. Sometimes spinal fluid is examined for infection, inflammation, for markers of some degenerative diseases. Plan. Treatment. It is important to know that dementia is not a curable disease, but that the symptoms can be treated. Cholinesterase inhibitors work by increasing acetylcholine levels. These medications include Aricept, Elexon, and ranitidine. There is also Namibia as another medication option, and it works by regulating glutamate, a chemical messenger involving memory and learning. With this patient, I would prescribe donenzapil 5 mg PO daily with Namibia XR 7 mg PO daily. This should help lessen her symptoms and prevent further deterioration. I would also prescribe lorazepam 1 milligram q6 hours PRN for anxiety and agitation. Differential diagnoses could include depression, delirium, and Parkinson's. Ruling out differential diagnosis. Delirium is a neurologic complication of illness or medications, especially common in older adults, manifested by new confusion and impairment of attention. It is believed to be caused by new stressors as a result of a decline in psychological aging. This diagnosis can be ruled out due to the fact the patient's symptoms are staying consistent and are not fluctuating. Also, current medications she is on are not related to memory loss. Depression. Depression can be described as a decreased interest in things that previously gave pleasure and is considered a primary mood disorder. This diagnosis would be ruled out in the fact that the patient still wants to do things that she enjoys. She has a negative PHQ-9 questionnaire score, and she had negative geriatric depression score. Parkinson's disease is a progressive neurodegenerative disorder. Cardinal symptoms include resting tremors, rigidity, bradykinesis, and postural instability. This diagnosis can be ruled out because the patient is not experiencing any tremors, motor stiffness, or decreased emotions. Final diagnosis and challenges. My final diagnosis for this patient would be unspecified dementia with behavioral disturbances. This diagnosis was chosen due to the patient's inability of short-term memory, anxiety, agitation, inability to communicate or produce words, and a score on the ADL's MMSE and Global Deterioration Scale for primary degenerative dementia and caregiver strain index tools. Challenges for this patient may include independence, remembering medications, basic self-care, and self-conflict. Community resources needed. Resources this patient and her family members will need to know about dementia and where to find help online and in their community. I will give the family the listed links below. The multidisciplinary health team members. The patient would need to be referred to a neurologist. I would set the patient up with a caseworker, the primary care provider. The patient would greatly benefit from a home health agency that includes nursing, physical therapy, occupational therapy, psych nursing, and a nursing aide. Discussion: social determinants, socioeconomic status, sex, age, cardiovascular risk factors, and previous involvement in family decision making. Providers should perform routine screening to monitor for early signs of dementia among elderly patients. Caregivers should be a part of the healthcare plan. Health determinants. Individuals must understand that patients are not purposely being difficult, but that this can be a form of communication. These behaviors consist of anxiety, forgetfulness, and agitation. Legal issues. The patient's inability to consent for medical and financial care if a legal representative was not made prior to the development of dementia. Planning early can allow help prevent legal issues that can be involved in financial and long-term care. Socioeconomic issues. Less educated individuals and those with a lower socioeconomic status have been found to predict cognitive decline. Researchers are still studying the link between education and socioeconomic status linked to dementia. What I have learned: there is no cure for dementia. Diagnosis is often made with primary care. It is expected that the global number of deaths related to dementia will increase 40% from 2015 to 2030. Dementia Dementia is often incorrectly referred to as senility or senile dementia, which reflects the formerly widespread but incorrect belief that a series of mental decline is a normal part of aging. Dementia is not a specific disease. It is an overall term that describes a group of symptoms associated with a decline in memory or thinking skills, severe enough to reduce a person's ability to perform everyday activities.